We think it's important that we reassure people with HIV that the commitment to providing care and treatment continues. So we're very pleased with that. And one of the more exciting things about this is that I've been around HIV for a long time, and quite frankly, I worked on Medicaid and Medicare. I wasn't an advocate for Ryan White. When I was at the National Association of People with AIDS, other people did that, and I sometimes came into the process at the end, and I saw the dysfunction of the AIDS community. I saw how the service providers were fighting amongst themselves, or the people with AIDS felt like people weren't listening to them. We also saw how it became unnecessarily partisan. What was great about this reauthorization was broadly bipartisan. And it should be bipartisan in 2009 that we can all recognize a commitment to providing care and treatment to people living with HIV and AIDS. The other thing the President did when he signed the Ryan White Law, and this is something that Jan mentioned briefly, is that he announced that we're eliminating the ban on entry for HIV-positive visitors and immigrants to the United States. This was something that was made possible by a change in law that Congress made in the last Congress. And so President Bush signed this, reauthorizing the PEPFAR program. He signed this change into law, and his administration started the process. But as the President said, we completed the job. So he announced that we published a final rule that eliminates this discriminatory practice, and it goes into effect on January 4th. I was talking to people. One of the things that we know we need to do is spend time addressing HIV stigma. And the President talked about this in announcing we want to lead the world, but yet we have a very discriminatory practice where we tell people we're afraid to let you enter our country because you have a condition. So we think it's a very important, both for individuals, but it also, taking this action, it brings us back into the company of nations we want to be with. The vast majority of nations around the world don't have these discriminatory policies, and it's really only about a dozen or so that do. And they're not countries that respect human and civil rights in the way the United States wants to. But that's also borne fruit. So just last week, when we commemorated World AIDS Day at the White House, Secretary of State Clinton announced that the International AIDS Society is going to be holding its 2012 International AIDS Conference in the United States. That'll be the first time in more than 20 years. They were going to have a conference in the United States once, and people with AIDS started demonstrating, and they essentially forced the conference to be shifted to the United States because of this entry ban. And we think it's an important opportunity for our country when we're a global leader on HIV/AIDS. We're developing a national HIV/AIDS strategy to bring the world to us, where we can exchange scientific information, policy information with so many stakeholders around the world. But it's also an opportunity to have the conference in Washington, D.C. Just in the suburbs of Washington, D.C. are the National Institutes of Health. We lead the world in biomedical research, and it'll really allow a broad engagement of the research community by bringing them to Washington, D.C. for this conference. So we're very excited. We're not done yet, but perhaps the most significant thing that I think we've undertaken, certainly not my office, but the President, is health reform. He's made a top priority to enact comprehensive health insurance reform, and it feels like we're getting really close. It feels like we've never come this far, and we're going to get there. We believe that this will make an enormous difference to make health care more secure and stable for all Americans. But there's nothing my office could do to get more people living with HIV into care through an AIDS initiative. It's this broad, comprehensive insurance reform that's going to do a lot to make sure people with HIV get their care and treatment needs met. We'll still have gaps. We'll still need the Ryan White program. We'll still have other work that we need to do. But we just believe no matter what the final contours of health reform legislation look like, this is going to be 20 steps forward. One thing I've noticed about this is that it's a little different on the outside versus the inside. Now I'm on the inside. A little more sensitive to the criticism. People saying to the President, you're doing too much all at once, you'll never get anything done, or we're worried about the economy, you shouldn't be doing health care. But I think he believes that health care is really fundamental to what we're trying to do, to get the country back on track, to get our economy. And so we're very excited about where we're headed with that. So now I'd like to turn to the National HIV/AIDS Strategy. I mentioned that the President made this commitment during the campaign. I think of this as an important opportunity for the country. We do have serious economic challenges. I would say that as bad as things are, they could have been worse if it weren't for really the unprecedented action that the President took in his first weeks in office, passing the American Reinvestment and Recovery Act, the economic stimulus legislation, provided unprecedented assistance to states and doing other things. So if we're very concerned, I've been traveling the country concerned about what we're seeing at state level cuts, local cuts, and it's not much solace, but it would have been worse if it weren't for unprecedented federal action. We also know that these are difficult times because we have an ongoing serious HIV epidemic in this country. Every year, more than 56,000 people become infected with HIV in the United States. Now, the positive way to look at this is to say this is a decline from previous highs of about 150,000 a year in the 1980s. But we've been level at 56,000 for many years, and that's too high, and it's been there for too long. We also know that we're because of the difficult economic crisis, we're having increasing challenges with our AIDS drug assistance programs. And every day we're hearing about more states that are imposing waiting lists, and people waiting for life-saving HIV treatments. The National HIV/AIDS Strategy won't make all these things go away, but it is an opportunity. And I think that the President believes that it's time to refocus public attention on the domestic epidemic. He's spoken about the PEPFAR program, the President's Emergency Plan for AIDS Relief, our global AIDS initiative, and he's always said that he wants us to honor what President Bush did in establishing PEPFAR. Earlier this year, President Obama proposed a broader global health initiative that really seeks to build on the success of PEPFAR and do more to build health systems and promote the health of people around the world. Taking nothing away from our global leadership, there's a sense that because we focused on global AIDS and the great things we're doing to provide treatment to people in Africa and other things, that somehow passively we've communicated this idea to some Americans that things aren't so bad here. We used to have an AIDS problem, we don't anymore. And I think the President believes we really need to remind the American people that we do have a serious challenge. Now, in thinking about this national HIV/AIDS strategy, I always like to tell people we're beginning from a place of success. It's not that in 2009 we're saying we haven't taken AIDS seriously, we need to start doing it. We do a lot of things right in this country. We spend a lot of money on HIV, but we need to stop and assess and refocus our efforts. We could come up with a strategy where we're doing many, many more things, but I think the opportunity presented is really to look for high payoff strategic items that will lead us forward. The President's identified 3 key goals for this strategy, and those are reducing HIV incidence, getting all people living with HIV into care, and we think of this broadly, improving their health outcomes. And the third goal is reducing HIV-related health disparities. So I have to admit I'm daunted in this challenge of developing a national HIV/AIDS strategy. I've never done it before. I look at what past attempts to develop strategic plans, and they haven't always been successful. And also, before I write that first word, I feel pretty certain I'll disappoint more people than I'll make happy. But it is an opportunity. So now I just want to tell you sort of how we're going to get there. President Obama, as you probably know, is a community organizer. He sort of comes from this community focus. The HIV community focused on developing a national HIV/AIDS strategy, got some resources to do this, and I think they asked our office to have at least 2 public meetings so they could weigh in on their ideas for the strategy. We know in this big country we can't get everywhere, but we're trying to do more than the minimum. This weekend I'm going to Puerto Rico, which will be the 14th and last community discussion we've had since August. So I've been traveling around the country with my staff, going as many places as we can, going to the traditional epicenters. So last week we were in New York City. They have always had a serious AIDS epidemic. They continue. The coast, California, we've been to San Francisco, Oakland, LA. But we also know HIV is growing in the South. So we've been to Jackson, Mississippi, Columbia, Houston, Fort Lauderdale. We've been to Minneapolis, trying to get all around the country. And what's interesting is there's a real strong desire for people to engage again in what we're doing. People felt like they haven't been listened to. What's been especially encouraging to me is throughout these places, the number of people with HIV coming forward and disclosing not only their HIV status, but very personal things in a way that can really inform our work. We also recognize, though, that 14 in this big country, we can't get everywhere, or even the places we go. Maybe people can't get to our discussions, or they might not feel open to speak. So we had a call to action. We gave people an opportunity to submit information online. We got several hundred submissions.